So he will take the message to his boss, and also the documents we are going to present, the 5-year study and the whole difficulty we went through. So, can you start the saga, please? Oh, it's not here. Oh, okay, okay. You can enter. This is the full documentation from 2006. Our dengue experience in terms of product development, patient treatment, and the great obstacles we faced when we presented it to the authorities. This is what I want the young gentleman to take note. The difficulties we had with authorities. You are part of the authority. So, of course, you are not in Ministry of Health. Huh? You are in education, but also this is the document. I consider this as the great masterpiece of AK. We will pass to him in a very ceremonious way at the VIP room later, and I hope you will carry this to your boss. Our good friend, the Honorable Deputy Minister of Higher Education, Dr. Saifuddin Abdullah, who comes from the same state I come from, we come from, Pahang. So we have some. Wait for a while. Okay? Now this story, very interesting. Before I go through quickly, I want to share some of my thoughts. In medicine, on this radio, in medicine, the greatest discoveries were accidental. For example, the discovery of penicillin, the most potent antibiotic during the war, was discovered accidentally. Dr. Alexander Fleming forgot to close his agar plate. The protocol he must close. He forgot, he didn't close. So he saw next day the fungus. Staphylococcus aureus bacteria, the fungus has gone in, and where the fungus was, there was no bacteria. Do you call that science or magic? Alexander Fleming did not practice science that time because he made a mistake in the scientific principle by not closing. But because he made a mistake, he discovered. I hope those people in the medical field will know this. Similarly, the great drug we now call Viagra, accidental discovery. They were working on heart and blood pressure, find something stood up very strong. Hey? Change the protocol. Today, 25 milligrams of Viagra is $25. 25 milligrams of gold is only $5. Are we ready? Okay. So, I can safely say this dengue discovery was also accidental. I did not work on dengue, but one day my friend said, my friend in the hospital is on drips, is having dengue. Do you think you can help? That's the time first I said, maybe you should try this. I'll show you after that all the facts and figures. From there it started. So the first one, within 24, 48, 72 hours, dengue was reversed. I thought it was coincidence. Are we on after that? How come we left that? Okay. Then the second patient, third patient, I thought it was coincidental. Cannot be. How can AK discover a cure for dengue? Impossible. And you're going to face, you know who? The DG, the Ministry of Health, the authorities, the MMA, Malay Medical Association, all out. AK is fraud. Simply claiming. I'm scared of that also. I have to be prepared. So one after another. Sorry, how long will it take? Couple of?
1 minute.
No. Okay. One. Coincidence. Two. Coincidence. Three. Coincidence. Four. Suspicion. Hey, suspect. Maybe you can. Fifth. Let's wait and see. Sixth. Something's happening. Seventh. Hey, I think the product is doing some work. Eighth. I was beginning to develop confidence. 9. I think I must document. 10. I think I found a cure. I will show you the 10 patients' name. And surprisingly, 2 of them were YBs from Sarawak, Kuching. 2 Datos. Show you after. 2 Datos. What happened to them? Admitted to hospital, private hospital. So we had an agent in Sarawak who was distributing the so-called spices, beans and cereals. So he took, because the Dato was his uncle, I said, go and give it to him. So Dato was bedridden, you know, as he said, dengue weakens you and you are heartache, fever, body aches and pains and not bleeding yet. So the young boy, he went to the hospital, had one room, this Dato, and what happened? The moment he wants to go, the specialist was there. The specialist says, what are you bringing inside this hospital? So the boy showed him this, my uncle wants, Dato wants. What? You are bringing some nonsense to this place. Don't give that to him. Then what happened? God intervened. I tell you how. The Dato stood up and told the doctor, I want to take that. I am responsible for what I am taking. I tell you, this is the story. How the doctors block, how God comes into the head of the Dato and says, say these words. I've analyzed it, I've meditated upon it. How come suddenly this Dato, first time from nowhere, some unknown, not popular product, and he took. Next day he woke up, platelets went up. See the name also, the quest and discovery of natural remedy for dengue fever. All the trials and tribulations, hindrances and hurdles. Now this one I'm directing to the authorities. Discovery of natural remedy. So the Dato stood up and they were doing blood tests every few hours, you know. See, the platelets are rising. The platelets keep on rising. And the doctors were confounded and confused. Within 2 days, he started walking, next day took breakfast and said goodbye to the hospital. Yeah. Okay? Can you go? Next page. Okay, this paper. Okay, next page. Right, look at the names. Can you see the Dato? Okay, that was Dato Talib's story, you know. Now, how did Dato Nordin come into the picture? After a few weeks, I think, not very long after that, see May also, his friend, also a member of State Assembly of Sarawak, suddenly collapsed in the house, fever. Taken to hospital, dengue fever. Quickly Dato' Talib said, no problem, we have found the cure. So he was given, and Nordin also from the same hospital, you see Norma Hospital, recovered at that same speed and rate. And then you see all the others, the 10 people, some from Singapore, Kajang, Kuantan, okay, Gleneagles, Singapore, you see that Guna guy, he was in ICU, he also escaped. The Chinese guy, he was in ICU bleeding, he was a bank manager, all escaped. Then the Thai boy, and finally the Singh. The Singh did some own experiment, you know. He wanted to find out whether really he had dengue in the first place, and second, whether the medicine worked. So he told the clinic, I want the report, and I want the IgG report, the immunoglobulin report, which confirms that dengue was there. And you will see later that that report confirmed he had dengue, he did not go to hospital, he recovered. So this is the first 10 magic which happened. And they are a spectrum, they are not everywhere, they are from all over the place, all types of people and all. So what I did, I have enough evidence to present it to the Ministry of Health. Next. See, considerations, this was my title. All doctors, healthcare, see, this is how I did. Considerations for the preliminary clinical studies on dengue fever and dengue hemorrhagic fever using spice bean cereals and vitamins natural formula. To present this was one hell of a hurdle. You think they will all come, all the virologists, specialists, everybody? Don't know how. We went to see the Prime Minister, Deputy Prime Minister, sorry. That time, this Prime Minister was the Deputy Prime Minister. So we saw his senior officer, and he called up the Deputy Minister of Health. That time was Dr. Latif. Said, please, my friend want to do something, please cooperate. So Dr. Latif called us, we went to see, we explained, and what he did, I don't know how this Dr. Latif, he's an MBBS doctor. He quickly called his special officer like yours, write one letter to DG. Immediately. So letter went to DG, we got a copy of the letter. But the DG was who? The great Ismail American, who talks more than he does. So, he was sleeping on it. We were pressurizing and pressurizing and pressurizing. You ask for results, she will tell you the story. Where, when we want to present. I don't know how God intervened into DG's brain again. And we got a letter from the ministry on that day. Go back, go back. Where is this one? Next. See. Okay. Come on the 20th of January to the Division of Traditional and Complementary Medicine. All the virologists, specialists, about 20 over people. You can see we videoed it. We videoed it and the video is available. And I presented the 10 cases. Scary also. Why scary? Virologists, chief physician, pathologists, all kinds of fellas. But to my surprise, when I finished 45 minutes of presentation, you can get the presentation there. What happened was, I asked, the chairman was my junior, I was his boss those days. He said, any question to ask AK? They asked 2 questions, there is no relevance to dengue. They were asking about homeopathy and something like that. So I asked the chairperson, what next? What he said is documented in the video. What he said was, Okay, Prof. AK, we were